How do we break that? If we're addicted to something, how do we turn that around naturally and safely?
Well, that is the purpose of what we're doing with the addiction treatment programs and educating physicians as well. Because if we don't know the major players in the brain and the body that are contributing to the addiction dis-ease, we will not ever address it properly. So what we're trying to do now is show them the team players in the addiction program or the addiction battlefield, so that way they really know how to tackle that, okay? So you can't tackle something you don't understand. So now it's so important to understand what the neurotransmitters' functions are, how to feed your neurotransmitters, how to create a well-balanced transmitter system, neurotransmitter system. So if you don't eat the proper way, that has the right amino acids, you cannot make the neurotransmitters that are necessary to create a balanced brain, like BB, a balanced brain. So once we learn about the food, that would help us, one thing. But the other thing is really accept people, love them where they're at, whether they're addicts or not addicts. Let's get beyond that, because we're having more addicts than we have normal people anymore, because we're all on something. So if we don't address this and accept these people and love them for who they are and teach them to love themselves, we won't get anywhere. So we have to begin with love also, because that boosts our dopamine level when you start the loving cascade. You get dopamine, you get oxytocin, you get all these wonderful neurotransmitters, and I call it neurotransmitters on demand. So by changing your mood, by changing your acceptance, you change your neurotransmitter production in your body. So you're more powerful than you think. So we can turn on our neurotransmitters just by changing our thought process or changing the energy and frequency around us. Second is really learn to detox safely, because when you're on a drug, your body depends completely on it. Whether that drug is a tobacco product, whether that's sex, whether it's that work, whether it's that exercise, it's still, you need to safely detox yourself from that. So we need to have physicians that are aware of how to safely coach people through that process of detoxification. I hope it's making some sense to you.
Yeah.
So that's really the purpose of the addiction treatment program, or addiction treatment modules, training for physicians that I have proposed to be taught at the University of South Florida and at the A4M, just because we want to help people and doctors become aware that this is a common problem. This is more common now than even obesity. It's more common now than even cancer. And 1 in 3 people are addicts. And there's more deaths from addiction than anything else. Driving and drunk and driving, it's happening. All the problems that happen as the victimization of people, or all the domestic disputes, or all the assaults, they're all stemming from dysfunctions in the neurotransmitters, So we have a lot more crime. But why is that? Because we have no control of our neuroendocrine system. So.